on 20 and 21st October 2014 took place at the Harare International Conference Center, Rainbow Towers Hotel, Harare, a consultative and training workshop on employment injury protection in Southern and Eastern Africa. The objective of the meeting was to promote learning between countries from Southern and Eastern Africa on the provision of employment injury protection, to shed some light on the various approaches to employment injury protection, including but not limited to prevention, compensation, and rehabilitation frameworks, to encourage cooperation within Southern and Eastern Africa region in the structuring and delivery of employment injury benefits, to better take into account labor migration in national legislation pertaining to employment injury protection, including the need for case management and care continuation when workers return home, to explore where there exist alternative instruments, measures, including non-contributory social protection programs to cater for disabled, poor and vulnerable workers at risk of extreme poverty and social exclusion, and finally to develop recommendations for the reform and future development of employment injury schemes in Southern Africa.
My country, as per my experience, has got so many challenges in terms of social security. So it is our chance to come here and learn what our friends are doing. For example, we have not yet created what we call a social insurance scheme. What we are doing is just one branch of social security, which is workers' compensation or employment injury.
Some of the challenges are the same in the SADC region. For example, you find that coverage is not extended to the informal sector. And then we also find that the benefits sometimes remain lower and they are not adjusted for a long time. Then we also find challenges like unclaimed money. The fund pay out benefit, but they cannot trace the beneficiaries.
The Workers' Compensation Act in our country does not compel the employer to keep the injured person at work unless or until there's light duty that can be provided to the worker. And if the employer feels like, okay, fine, I will take this man again or the woman back at work.
Many and an increasingly number of national schemes of employment injury provision in the world have set wider aims in terms of returning workers to productive activity in a timely manner and of encouraging and maintaining optimum levels of health and safety in the workplace. Many low-income countries, including in Southern and Eastern Africa, continue to rely on the principle of employer's liability for organizing employment injury protection. These systems are faced with a number of significant problems, including the individual employer's business inability to pay multiple compensation claims in the event of a severe accident. Many countries have found advantages to replace employer liability systems by schemes of social insurance, which in effect extend a no-fault principle to share the costs not on a pool of employers but across society through schemes of social insurance.
Employment injury protection is guaranteed in several international and regional instruments. I'll start with the United Nations. This is not a social security convention, ladies and gentlemen, but it has got important provisions concerning disability. And if you look at this instrument, it says member states must ensure that, or must work towards ensuring that persons with disabilities enjoy the right to participate in the labor market, if I could use my words to unpack that. It goes on by saying member states must guarantee that persons with disability enjoy adequate standard of living, which should include social protection. And remember, disability can arise from different reasons or sources, which include having met or suffered an injury during one's employment, and that should be covered. Most of the persons that participate in the labor market, if we put it that way, are in the informal sector. Many of these countries have got high informal sector employment, which is a problem because in most instances, these are the persons that are not covered by the workers' compensation schemes.
Looking at the challenges, these become evident, self-evident, if you can say. We need to review our legislation. Complete, comprehensive review of legislation in the region. We need to look at what these laws say and if they talk to the times. 2014, are we where we are supposed to be? Extension of coverage, that is clear. As many people as possible need to be covered. Especially the vulnerable groups of people, even high-level public servants, because in many countries they will say your military personnel are out, your public servants are out. We should get a way to get as many people covered as possible to make sure the schemes are sustainable, because if you get everybody together, there's cross-subsidization, there's solidarity in this case, so we need to look at some of those things. Replacement of employer liability schemes with social insurance, that was long recognized and is even recognized now. We need to get our systems from employer liability schemes to social insurance. Prevention and rehabilitation integration should be our focus. They say you prevent, if you want to prevent accidents to occur, you rehabilitate, you reintegrate. Then, only those who cannot rehabilitate and reintegrate should you pay compensation, which means the people who receive compensation will be very few, because most of them will be going back to work. Not the case where you pay somebody and they sit at home without any rehabilitation. Then improvement of monitoring and enforcement. The laws are there. They provide for duties, they provide for obligations, but they need to be monitored.
The paraplegics who are not able to look after themselves, usually if it's a man, we train their wife to look after them. If it's a wife, well, in very few cases, we don't train the men, but we look for someone to be able to nurse them, to look after them. And we call it post-10 attendance allowance, which we pay that particular person who is helping our injured worker. We pay them 80% of the minimum pension of the scheme. We also have rehabilitation services where we offer the medical treatment, spinal injury care, physiotherapy, and occupational therapy, counseling, and we also offer vocational training to assist injured workers to reintegrate back into the community and also in the workplace.
In Kenya, we have a scheme we call National Social Security Fund, but it doesn't deal with occupational health and safety and employment injury compensation. It is dealing with just general social security. So in Kenya, we want to come up with an authority, which we are going to call Occupational Safety and Health Injury Compensation Authority. And it is going to handle both occupational safety and health matters and employment injury compensation. So I'm going to moot this idea of a rehabilitation center to the authorities because I think it's a good idea.
We are working on changing the Act so that we can also allow for electronic filing of claims. Now, we also have a challenge of doctors and hospitals refusing to treat injury on the injured for various reasons. I have already mentioned the tariffs, and sometimes they say that payment take too long, and they then say, we can treat you, but as a private patient, or you must pay, and then you claim from the fund. Or your employer must pay for us, or must sign this surety that they will pay if the case is not paid on time. The issue that I have said coverage to the informal sector is limited, and I would say is due to lack of awareness or enforcement, or both. So we do not really find that the legal impediment to covering the informal sector is the cause. And we have cases where informal sector have joined, but very few of them have joined the scheme. And there is also a lack of effective dispute and appeal mechanism. It relates to the cost. One is the cost, and the time of settling appeals and dispute is prohibitive to many people who should benefit. And I have already mentioned the issue of emerging occupational diseases and conditions that are not listed. In Namibia we have malaria. Sometimes when people travel from one area to the other, they might contract malaria whilst they are on duty. It doesn't necessarily mean that that is an occupational disease, but it's a condition that can be compensable in terms of the Act. There are weak linkages in terms of the incentives that merit rebate provide. The system of merit rebate provide refund to the employers up to 50% of the assessment paid over 3-year period, 3-year cycle for favorable claims history. Now, if the employers have submitted less claims, they might get up to 50% of what they have paid. But then the Commission have a discretion as to how they pay merit rebates. What I've said is that sometimes employers who are really in for getting merit rebates, they try to prevent reporting of accidents so that they can get merit rebates. But it's something that I said, there is no study done in terms of whether that is really an effective way of promoting safety at work.
In the case of Namibia, there's no legal impediment, for example, for extension. And what you need is really simplified ways for people to contribute and to know what is their status and so on. And I think there's a great deal of potential of using information technology.
So the methodology that we used in the study is we did a secondary analysis of the National Income Dynamics Survey. This is a panel survey which is conducted by UCT and it's funded by the Presidency. And it follows the same respondents and collects data every 2 to 3 years on education, income, employment, access to basic services, and a whole lot of other indicators of well-being. So when we looked at income, people with disabilities earned a median income of almost 400 Rand less than non-disabled people. However, we found that their disability was not a significant factor in their earnings. What was more striking was the effects of gender and race. Keeping in mind that the NIDS data was collected over, I think now they're in their 4th wave of data collection, but for this we looked at wave 1 and 2. So when we compared the 2 waves, we realized that the effects of gender and race were evening out in wave 2, and so the effects of disabilities were becoming more marked. So what this is showing is that employment equity acts, for instance, are having the intended effects for gender and race, but not for people with disabilities. Broadly targeted social services, i.e. basic services package, across the population means that people with disabilities also benefit. The disability grant does have a poverty alleviating effect for people with disabilities, but given the high employment rates, there are some challenges with this grant in that we find that in households that receive a disability grant, they tend to be larger because the amount of the disability grant is larger than most of the other grants. People tend to congregate around the grant recipient. In addition to this, the HIV epidemic means that the disability grant is accessed in far larger numbers than it was originally anticipated, putting forward the question of sustainability. And if people with HIV, if their CD4 counts are below 200, then they qualify for the grant, but if it increases, the grant can be revoked.
The mine-sending communities are not tapping on the social labor plans. Remember, social labor plans are there not only for the receiving community, but for the sending community. So when we starting to engage with the mining industry, we need to find out what is it that you as a mining industry are doing for Swaziland? What is it that you are doing for Lesotho? What is it that you are doing for Mozambique? Because you are recruiting mine workers in this country. So a portion of your profit should be actually dedicated into uplifting the communities of the whole country. Social labor plan is about assisting those communities, fixing of those roads. You could see some of the areas where people with spinal cord injuries, I mean, the toilet is there. You know, do we expect somebody to actually push a wheelchair up until to where the toilet is? And sometimes what happens, the mine would move the toilet from where the toilet is and actually try and put a ramp up until where the toilet would be more accessible to the mine worker. And some of the mine workers, for example, in Lesotho, you'd find that they're actually staying in the mountain. And so it would be difficult for that person in the mountain to actually push a wheelchair until to where the road is. And with the help of the local leaders, we have been able to actually request that those people be relocated to more suitable area.
Have a look at what happened in Britain in 2012, and it will tell you asbestos cost rules that insurance have to pay what? 5 billion in terms of compensation. And I know yesterday we said the occupational disease is normally tied to the date when it was diagnosed, but this court said what? The Supreme Court rules that liability was triggered when people are exposed. So we'll come back to see why you exposed at this time. Then this worker suffered this, so you are liable from that time. That means that we should always have good occupational safety and health programs. They actually can return. And I came up with a very simple model, very simple for us, that if you have a very unhealthy work environment, which has health hazards, you'll expose your workers, they will get ill, they will be diagnosed, they will be treated. Some will not be treated because there's no treatment. You get a healthy worker. But if you take that worker back, the same continues. Productivity also continues going what? Down.
On the African continent, it's about weak enforcement mechanisms, lack of seasoned, experienced inspectors. How best can we go about strengthening our labor inspectorate to make sure that they really do an effective job out there?
We see what you can do with the resources that you have. And that's why we are saying, even at enterprise level, I showed you two parallels. One at national level, one at enterprise level. Each company will carry out a risk assessment. They will see which areas they need to do what? To improve on. And then when the inspector comes, he does not come to start looking for mistakes. He starts to come and ask, where is your program on occupational safety and health? Where is your policy? How are you going on? Show me your plan of action. Yeah? Are you together? And when are you going to measure it? And then you can now discuss how it's being implemented, which areas will you require support, training, and material. Yeah? This is the way inspection services, and I foresee inspection services taking in the future.
The global trend towards coverage under social insurance is encouraging. And this framework, the social insurance framework, helps to promote a rights and solidarity-based perspective. And employment injury has a few specific challenges which we saw. These were just a flavor, taste of them. Administration is key. We also talked about that. And research, exchange of information, capacity building must be accompanied by communication, sensitization, education.
This is where all the processes are done. When we receive employment injury reports from employers, they come through a claim form that the employer completes. We call it WCI 14, Workers' Compensation Insurance Fund form number 14, which is a claim form. So this claim form comes from the employer, it gets to this office where we record receipt of the claim, and we also do the coding, and also we allocate a claim number to that accident report so that the process can now begin. This is the index card that we use for indexing the claims. Each employer has got an index card. The index card will give us a record of all the reports from one employer. So we have got an index card for each and every employer. If you want to know the claims that we have received from a particular employer, we can come and get the summary from the index card. Team NASA meet delegates from the SADC and Eastern Africa, right? Okay. The people you are seeing in front of you are Team NASA, and this is our registry office, right? This is where we open the physical files, the claim files, like this one, right? When we receive those claim forms, which you saw down there, they are fed to this office, and they will now open the file and do statistical coding, where processing officers will diarize a ledger sheet where we'll enter some payments that will make on that file. They put all that relevant documentation on the file, so that we start processing any benefits that are payable on that particular claim. Because one claim can have several benefits payable on it, right? So this is the statistical coding form that I'm talking about. It will give information about which part of the board, when the accident happened, all that kind of thing.
Ideally, we should fill this section of the form, percentage disability, all the payments made. But these are preliminary statistics, you are very correct. We would not have finalized, but if we had finalized the case, then we would have compiled the full record, which enables us to tell the age of the injured worker, the sex, marital status, the earnings, occupation, number of dependents, place of accident activity, during accident, the agents of accident, the type of accident, whether there was an unsafe factor involved, the body part injured. These are the statistics which we can collect from this form.
Yes. How do you verify the information that is coming, especially on occupational diseases, before filling the form?
Do you? Form.
Yeah. Do you do that?
Yeah, because this information is obtained from the employer. This is the same form. Yeah. It will be indicated, and also within the file, our medical doctor would have ascertained that it's a medical, it's an occupational disease. Okay. So we then code it accordingly here, where it is written nature of injury. So if it is pneumoconiosis, it has its own code.
Since you have all these data, do you also then consult and give training to those particular sectors and industries to avoid future occupational health hazards? Are there training groups, whatever, and also for the side of the employees?
Right.
What is the programming there?
We calculate various indicators from these statistics, like the injury frequency rates, incidence rates per sector. We have, because the workers' compensation, the full name is Accident Prevention and Workers' Compensation Insurance Scheme. We have the Accident Prevention branch. They are the ones who deal with education. They train occupational health practitioners.
So the access to that data is crucial.
Exactly. These data points where the problems are.
And also problematic companies.
You are very correct. The processes which we have gone through in the region up to where we were is duplicated at the regional offices throughout Zimbabwe.
Yes.
They do the same processes. But for pensions, the files that now go for pension, they are now processed within this department. Exactly.
Central.
These are the pensions which we then pay through the post offices, through warrants or through banks. But the other short-term benefits which we have seen, it's duplicated throughout the country at the regional office. They make the payments wherever they are.
I've actually learned, what is available out there in Kenya, in Namibia, in Swaziland, Lesotho, and also in Mozambique. And I think it's initiatives like this where people can be able to draw some lessons learned and actually go back into their countries and say, what is it that we've learned at this workshop, and be able to say, can we tweak our program? Can we improve our program? But I think it's such a learning experience.
The workshop really, it was really the true workshop in the true sense of the word, and I think really it has been able to meet its objective of trying to say, look, I think it's high time now that we move away from the old system of employer liability schemes now to what we call social insurance, because social insurance seems to be having so many advantages relative to the old system of employer liability scheme.
In most of the countries, in fact in all of the countries which we are represented here, they indicated that they do not have a rehabilitation center, which is a unique arrangement which we have with our workers' compensation insurance fund. We have a rehabilitation center in Bulawayo where injured workers are rehabilitated and their functionalities of their organs are improved. We have that center.
So here they have the employer liability. In Lesotho also we have the employer liability, but the difference in Lesotho is after we have collected the money from the employer, it is invested in the insurance company. Here it's invested in the fund, which I think Lesotho will take it as an example for the employer liability. I think in Lesotho we have challenges, which we are still using the outdated laws.
That all our schemes allow for portability of benefits across boundaries. Now we have challenges tracing these our pensioners when they move back to their countries of origin. I think what I've discovered is we have a good number of pensioners in Zimbabwe that suffered injuries in Zambia. We have a good number of pensioners in Malawi, and we do not have life certificates for this. Therefore, we cannot pay them because we can't trace them. I believe some of them are even dead. So what this workshop has afforded us, it has afforded us a chance of trying to air out the challenges to each other. My wish is that we could have these workshops at this level as frequently as possible to try and see how we can help our beneficiaries. As you know, our clients are special. They are not like, beneficiaries of an employment injury scheme differ from beneficiaries of old age schemes or pension houses, because those are pensioners by virtue of having reached a certain retirement age. But with us, these are people that suffered injuries. These are people that experienced severe pain. So we need as much as possible to pay special attention to these people because they suffered pain. And we should not even subject them to further pain. I think that's all I can say for the moment.